Good evening. This is Nationwide on NTA. I am Ifoma Ojinta. Thanks for joining us. 204 new cases of COVID-19 have been confirmed in Nigeria by the Nigeria Center for Disease Control. A breakdown of the figures showed that 80 cases were in Kano, 45 in Lagos, 12 in Gombe, 9 in Bauchi, 9 in Sokoto, 7 each in Edo and Borno, while Rivers and Ogun had 6 each. The FCT, Akwa Ibom and Bayelsa states have 4 each. Oyo 2, Delta 2, Nasarawa 2 and Ondo 1. As at 11:50 p.m. April 30th, 2020, the total number of confirmed cases have risen to 1,932. 319 patients have been discharged and 58 deaths recorded. The federal government has issued a comprehensive guideline on the gradual ease of the total lockdown, which will commence on Monday, 4th May 2020. This is following the presidential broadcast of Monday, 27th April 2020, in which President Muhammadu Buhari announced the gradual ease of lifting of the lockdown in Lagos, Ogun, and the Federal Capital Territory, Abuja. Donyidia reports.
The statement signed by Secretary to Government of the Federation and Chairman Presidential Committee on COVID-19, Boss Mustafa, provides general information on new COVID-19 measures and protocols for containment of the disease. The federal government acknowledged the improvements in the multi-sectoral response to the coronavirus pandemic and wants all the existing guidelines on proper hygiene to be maintained. The ease of the lockdown is also characterized by enforceable actions such as compulsory use of non-medical face masks covering for all persons while in public spaces, mandatory temperature checks to be conducted in public spaces, religious gatherings are still restricted, and mandatory supervised isolation of persons arriving from outside the country for at least 14 days. The imposition of overnight nationwide curfew from 8 p.m. to 6 a.m. starting from May 4th to 17, 2020. Movement of persons between local government areas is strongly discouraged except for critical healthcare, work and shopping for necessary food items. For the agricultural sector, persons above the age of 65 years and those with underlying chronic illness such as diabetes and high blood pressure are advised to remain at home. Trucks bearing agricultural and animal products are allowed easy passage. Government offices and other corporate entities are to open from 8 a.m. to 2 p.m. daily with limited staff working to between 30 to 50%. So as to maintain social distancing. Local authorities are allowed to determine date and time for the opening of neighborhood markets, abattoirs and warehouses not more than 3 times a week. Recreational centers such as beer parlors, clubs, gardens and others are to remain closed with suspension of the usage of recreational parks, communal sports, concerts, social parties, movie theaters, amongst others, except for food restaurants, which are allowed to open from 8 a.m. to 3 p.m. only for buy and takeaway services. All schools are to remain closed to further evaluation, as schools are encouraged to continue with e-learning and visual teaching. State governments and security agencies are therefore enjoined to ensure effective, strict enforcement of the guidelines, as the level of compliance will be reviewed in 2 weeks before additional guidelines for phase 2 will be issued. In Abuja, Donyidia, NTA News.
It is incredible that coronavirus could keep workers away from the 2020 Workers' Day celebration worldwide, usually observed every 1st of May, a day to assess how government and employers have responded to workers' needs vis-a-vis economic prosperity within the year. Large gathering like it used to be over the years is certainly not possible this 2020 May Day celebration due to coronavirus pandemic, which has shut down every human endeavor. Let's join Labour correspondent Emmanuel Anyimiro to tell us how the International Labour Organization is canvassing the adoption of relevant ILO conventions and standards for post-COVID-19 economic recovery.
We commend the National Assembly and President Muhammadu Buhari for ascending to our demand for an increased national minimum wage.
On all governments at all levels and also the private sector to ensure that contributory pensions deductions both from the staff and from employers are remitted to pension administrators as at when due.
These were the highlights of the 2019 Workers' Day, the year that witnessed the implementation of national minimum wage in August, with officers on level 4 and below, while others began in December 2019. Every category of worker were paid arrears of 8 months as well. Even though the 2020 Workers' Day is devoid of any gathering due to coronavirus pandemic, the International Labour Organization, ILO, is already looking beyond, suggesting how governments and international institutions can mitigate the effects.
We need to continue to try to stimulate the global economy, and that works best when there is better international cooperation. We need to promote policies that both protect and sustain enterprises, support income, and lead to job retention.
The third edition of ILO's monitoring of COVID-19 and the World of Work says the drop in working hours in the current second quarter of 2020 is significantly worse than previously estimated. This is especially on the informal economy, with about 2 billion workers worldwide, which is more than half global workforce, puts the workers at immediate danger of having their livelihoods destroyed.
Axiomatically, we all know that the informal economy, where about 6 out of 10 of all working people in the world make their living, is synonymous with unprotected work, precarity at work. And so it is important that we see what is going on in this most vulnerable part of the global labour market.
As the pandemic and jobs crisis evolve, the need to protect the most vulnerable becomes even more urgent, says the ILO Director General Guy Ryder. For millions of workers, no income means no food, no security, and no future. So the 2020 Workers' Day provides another opportunity to press for stronger economic policies together with stimulus packages critical to making recovery effective and sustainable. Emmanuel Anyimiro, NTA News.
Meanwhile, the leadership of the organized labor has joined workers across the globe to mark Workers' Day celebration in a low key without the usual fanfare and large gathering of crowd that usually characterized the previous celebrations as a result of COVID-19 lockdown. The occasion, which took place at the Labour House in Abuja, afforded workers' representatives to remind governments at all levels to begin to engage on mitigating the impact of COVID-19 on socio-economic situation of the country.
The peculiar need here is to invest in social protection measures which can help mitigate the worst shock of the crisis while acting as an economic stabilizer.
Employers and workers owe the economy the joint responsibility to sustain productivity and competitiveness of business from continued employment of the workforce.
Since Nigeria depends largely on crude oil for foreign earning, Labour wants the economy to be diversified to avoid over-dependence on only one commodity, which, when affected at the global market, the consequences will be severe on the country. And more stories on the day as we link up with Funke Ibidamitan in Ibadan.
Workers' Day. Labour and government converge converge right here at the Leko Salami Stadium at Damasingba here in Ibadan to interface on affairs concerning labor and government. Today, the narrative is different. No thanks to COVID-19.
Currently in Oyo State, any gathering that is of more than 10 people is illegal, is not welcome. And because of that, we are unable to hold a normal rally. Because the theme for this year's celebration is 60 years of nationhood.
We expect the government to do a kind of a palliative measures to the essential staffs that are working at this point. At least is a kind of a hazard allowance will not be too much to be added to the salary of the media workers.
It's been full of mixed feelings for journalists and for other people of the society. Last year we celebrated one, and we are looking forward to a better celebration this year. But unfortunately, today we have something in our hand, a pandemic.
Being a public holiday as declared by the federal government, civil servants and members of the organized labor in Ibadan say it's business as usual with the ongoing ban on mass gathering. Iseleto, E-Africa, in Ibadan, Funke Bidamito, NTA News.
Many thanks, Funke. Now, the federal government says it remains committed to ensuring the welfare and security of Nigerian workers despite the coronavirus pandemic. The Minister for Labour and Employment, Dr. Chris Ngige, made this known while speaking with other labour union administrators on Good Morning Nigeria. Daniel Aderiye tells us more.
It will be the first time in 40 years that the Workers' Day celebration would be done without the usual fanfare. Despite that, guests on Good Morning Nigeria say that though the livelihood of workers are threatened by this pandemic, the approach and measures used in combating COVID-19 must be inward-born.
At this point in time, the working class are actually at the receiving end because all the threats are targeted at the working class. Yes, the problem is global. But we must think also inward to see how we protect means of livelihood, how we're able to continue to produce, and importantly is also how to keep our people safe.
Health first, for people to be alive, before we talk about economy. Second is economy, job retention, preserve the ones we have, and then make efforts to create more.
Regardless of the loopholes that COVID-19 has revealed so far, other guests, however, called on the adoption of an intense and vibrant approach in tackling the economic and health impacts of the pandemic post-COVID-19.
We need to invest more in preventive care, and that would bring that we need to create even more jobs so we don't need to sack.
We want to appeal that the palliative, the first one we want to appeal for is that there should be proper medical facilities in the country.
And as representative body of organized businesses, our position has always been to every employers of labor that you must also pay back the loyalty of your workers by carrying them along and maintaining the full complement of your workers for as long as it is practicable.
They urged the Nigerian workforce to adhere strictly to the preventive measures laid down by the health authorities, even as the workers commemorate May Day. In Abuja, Daniel Aderiye, NTA News.
We now pause on Nationwide to bring you the daily briefing by the Presidential Task Force on COVID-19.
Good ladies and gentlemen of the press, I say a big good afternoon, and I welcome you to the national briefing for today, Friday, 1st of May 2020. I use this medium to extend our felicitations to all Nigerian workers as we celebrate the year 2020 Labor Day. The nation appreciates your tenacity in driving the economy. Together, we can build a more viable country. I also wish to thank our healthcare workers, the media, security agents, and indeed all workers from different sectors that go out into the storm of COVID-19 every day, we say a big thank you. Your contributions have in no small measure yielded the achievements recorded so far. The atmosphere for this year's celebration, more than anything else, forcefully reminds us of the disruption to our hitherto normal way of life and challenges us not only as workers, but also as citizens, and to leave no stone unturned in our efforts to return to a semblance of normalcy. The reality is that our lives and the way we knew it can never be the same again post-COVID-19. The reality also further challenges the labor movement to carry out research and develop new strategies for workplace operations and identify innovative ways of ensuring that productivity of the labor force remains a key driver to the nation's economic growth. Particularly, the challenges we are currently facing in the health sector on account of COVID-19 should be given the due and adequate attention. This year's labor theme, maintaining safety and security in the workplace, further emphasizes the importance of ensuring that all Nigerian workers are adequately protected to increase their productivity. Similarly, it places on the workers the obligation to take responsibility by adhering to the implementation guidelines that have been developed and circulated, especially in this COVID-19 era. The emphasis on safety has been underscored by the determination of the Presidential Task Force to ensure the provisions of PPEs and related gears for healthcare workers, security personnel, and other essential workers. Ladies and gentlemen, as we approach the commencement of the new phase of our COVID-19 control measures, I implore all of us to individually and collectively prepare and deploy all the necessary requirements of the recommended non-pharmaceutical interventions. We must also commit to making it a success through compliance. In this regard, I wish to commend the Nigerian Employers Consultative Association, NECA, for developing and circulating an adaptation of the implementation guidelines released by the PTF COVID-19. I also urge all business entities as well as trade associations, especially markets and transport unions, to similarly adapt and widely circulate these guidelines. The Presidential Task Force COVID-19 remains committed to containing the spread of the virus in Nigeria and would always be ready to provide specific and necessary support to any component of our federating units as an objective of the national response. In line with the above, I wish to inform you that our response to the situation in Kano is producing expected outcomes since testing was ramped up. The State Task Force, in collaboration with our teams, have also expanded contact tracing and isolation. A lot of emphasis is being placed on training of different categories of manpower: medical, nursing, cleaners, etc. Building of capacity for coordination, care management, and supply chain. We are also putting together a structure from the Presidential Task Force to provide support on a full-time basis. The United Nations system, coordinated by the World Health Organization, is also putting together a search team and repurposing 3,000 community informants from the primary health care in Kano State to strengthen the coordination of the COVID-19 at state and local government levels. Although the spike in numbers coming out of Kano is a bit worrisome, global trends show that such indicates the discovery of previously undetected cases and creates greater opportunities for detection, isolation, care, and management. As mentioned earlier, the guidelines for phase 1 of the eased lockdown has been released. We urge all states to adopt them and ensure the creation of awareness and compliance. The Presidential Task Force will be meeting with the security agencies this weekend to fashion out modalities for enforcement. Finally, I've been encouraged by the feedback from Nigerians on the need to deepen research into COVID-19 so that a homegrown cure could be found. Part of the mandate of the Presidential Task Force is to build a strong base for research. I therefore urge our scientists and researchers to come up with their findings and follow the validation protocols. The Minister of Health and the DG, Nigerian Center for Disease Control, will now update you on new developments. I want to thank you for your kind attention and wish you a joyous celebration of the Nigerian Labor Day. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, Directors General and Directors, ladies and gentlemen. I join the Secretary to the Government of the Federation in bringing you all special greetings on this special International Workers' Day, which also marks 64 days since the index case of coronavirus appeared in Nigeria and caused the onset of the COVID-19 pandemic in Nigeria, during which much has changed. The daily course of our lives has been disrupted, and the number of persons affected by the disease has continued to rise. Among countries of the world, we have seen horrendous fatalities, livelihoods destroyed, and economies shut down. This virus has affected all of us, from those struggling to survive to those struggling to return home from abroad, and it has even forced changes right at the heart of governments. We have survived many past epidemics, but COVID-19 has been the most difficult and damaging that nations and healthcare systems have faced in recent times. It hasn't been different for Nigeria. With regard to the COVID-19 infection, only 2 states have not yet reported a case at all. 204 cases were reported in the last 24 hours, Kano being 80, Lagos 45, Gombe 12, Sokoto 9, Bauchi 9, Edo 7, Borno 7, Rivers 6, Ogun 6, Federal Capital Territory 4, Akwa Ibom 4, Bayelsa 4, Kaduna 3, Oyo 2, Delta 2, Nasarawa 2, Ondo 1, Kebbi 1. 12 patients were discharged in the past day, 7 in Lagos, 2 in Ogun, 1 in Akwa Ibom, 1 in Edo, and 1 in Sokoto, bringing the total number of those treated and discharged to 319. These numbers speak for themselves because through 204 cases, new cases are the highest count yet. We now have nearly 1,000 in Lagos and more than about 219 in Kano. We have sadly lost 51 persons, each one painful and difficult to share. On behalf of the government, our prayers go out to their families. We have discharged, as said, 319, a number that we are working to increase daily. So there is hope on coronavirus. We have now activated 18 laboratories nationwide to increase testing capacity and improve case management. Partners and Nigerians, both home and abroad, are volunteering to serve and support our efforts. But the tribute I pay today is to the workers of our healthcare system. Doctors, nurses, lab technicians, scientists, and unsung heroes like cleaners, drivers, clerks, ad hoc staff are the Nigerians in the front line. We know that many offices have been working nearly 7 days a week since the outbreak started. Others, more, have stretched themselves almost to capacity, but are still going strong, showing the Nigerian capacity for resilience and fortitude. I say to you all, Happy Workers' Day, and to their families, thank you. We will do all we can to protect your family and your loved ones. We can support the health workers by following the advisories. Stay home, wear your mask if you must go out, observe hand and respiratory hygiene, and observe social distancing. I also seize the opportunity to call on health workers to continue to follow laid down standard infection prevention and control measures, to protect themselves, and to treat every patient with care and attention. But please do not refuse anyone care. With regard to Kano, a multi-sectoral team of 14 specialists comprising of persons from NCDC, NPHCDA, that's the National Primary Healthcare Development Agency, the Department of Hospital Services, the Department of Family Health, infectious disease specialists from IROA, media, and the special advisor will leave for Kano in the early morning to support that state in all areas of response. The main focus of intervention is on training, and capacity building of state healthcare workforce along the various specialties on a very massive scale. On case management, medical, nursing, and cleaning staff shall be trained or retrained. The National Primary Healthcare Development Agency will engage its extensive Kano State network to drive testing demand at grassroots through community mobilization so that NCDC testing strategy can be realized. We get complaints, unfortunately, about patients who suffer from other ailments not being attended to even in private hospitals or public hospitals in this era of COVID-19, which raises concern for immunization, reproductive, maternal, neonatal, and child health, and routine service coverage. A senior official from the Department of Family Health, from the Ministry of Health, is therefore also on this team to go to Kano to help drive the continuation of essential health care, even at private and public hospitals. We shall do all we can to combat this virus, but we cannot do it alone. I earlier mentioned the several outbreaks we in Nigeria have overcome. We, as a nation, must rally together to show how strong we are to handle coronavirus. Thank you.
Chair of the Presidential Task Force, Honorable Ministers for Health, ladies and gentlemen of the press. I'd like to join the Secretary of the Federal Government of Nigeria, the Honorable Minister of Health, to really acknowledge and celebrate Nigerian workers all over the country today. When I came into public service 4 years ago, the narrative about the public sector was very bleak. I was told about the people I was going to work with in very uncomplimentary terms. My experience of Nigerian public sector workers has been the complete opposite. Every single day I go to work and meet a set of people that are absolutely committed to their tasks, go way above the call of duty, work till 12 p.m. almost every day, Saturdays, Sundays, especially now as we respond to this outbreak. So today I really celebrate all the health workers, in fact all the workers, whether they're in the security services, the public sector, and across the country, working hard to keep us safe. You're the pride of our nation. We need you to keep pushing. Don't give up. And let's keep at this until we get to the end of this outbreak. So I'll keep my comments for today fairly short, just to celebrate the workers of Nigeria, including, of course, gentlemen and ladies of the press gathered here today on Workers' Day, instead of staying at home with your families. We really appreciate all the work that you're doing on behalf of our country. But I also want to acknowledge a lot of people that have supported the response in many ways. This week, students and staff of a school called the Center for Teaching and Learning Academy in Abuja visited our office with eggs, chicken, a few drinks, and said that this is what they had to offer to the people doing the work on behalf of our country. I'd like to say thank you very much. But also, effort has come from surprising places. The road to the National Reference Center, National Reference Lab in Abuja, a 2-kilometer stretch of road, has been in despair for many years. Over the last 2 weeks, the Ministry of the Federal Capital Territory and the Federal Capital Development Agency, without any nudging, at least none that I know of, has almost completed the rehabilitation of that road, making it safer for workers to go to work every morning and leave the offices at night. My colleagues and staff of the Federal Ministry of Health, National Primary Healthcare Development Agency, National Agency for the Control of AIDS, National Health Insurance Scheme, and all the other parastatals in the health sector that are seconded to NCDC at the moment are scattered around the country responding to this outbreak. I'd like to say thank you very much. Colleagues in the National Petroleum Corporation of Nigeria, NNPC, the Independent Nigerian Electoral Commission, who have offered us their vehicles in many states that are carrying our workers around the country, supporting the response. Colleagues in the Nigerian Air Force that have been carrying us across the country, the Rural Electrification Agency that is right now providing solar power across many treatment centers across the country. Colleagues in the Nigerian Medical Association, the Independent Petroleum Producers Group in Nigeria, many other organizations, Association of Public Health Physicians of Nigeria, Nigeria Communications Commission that has slashed our data rates for which we use to make calls and send data across the country, the Society for Public Health Professionals of Nigeria. We thank you very much and all your workers for the sacrifices that you're making. But of course, workers in the private sector are not out of this. They've really been supporting the work from the big corporate Nigeria, the Aliko Dangote Foundation, Nigerian Breweries, Hypo, UBA, but also smaller firms like Yellow Chili, Seaway, 54 Gene that is now deploying its third mobile lab to Kano this weekend. We thank you very much for all the work that you do. There's Blade Farms, Tropical General Investments, Seaway, the Kakovid Group, GIG Motors. GIG Motors, out of nowhere, offered us 6 buses that take our staff home at night and bring them to work in the morning across our 3 sites. They have not publicized this. They asked me not to publicize it, but I'm breaking their request today. Quietly supporting the response, they bring their drivers to NCDC in the morning, they take staff home in the evening on their own. So I'm really grateful to all of you that have been supporting this response. Many churches and mosques, Islamic communities and Christian communities have been supporting the response in many ways. We thank their communities, their congregations, their workers, their imams, their priests, their pastors across the country. I'll stop here for now. There are many more that have supported the response. We keep track of every single donation that comes to the work that we're doing. We write individually back. We will account for every single egg, every chicken, every naira that comes to support the response. We're grateful to Nigerians. We're stronger together. Have a happy Workers' Day.
Thank you. That sums up the technical briefing. We shall now take the questions. Are we ready?
Yes, sir.
Okay.
Good afternoon, guys. My name is Juliana Taiwo Obaloye. I write for the Sun newspapers. SGF, sir, all my questions are for you today. First question, contractors to federal government agencies said they are being owed. Contractors to federal government agencies said they are being owed because ministries have not released to them first quarter allocation. Lockdown, they are saying their situation is there, and they are asking how can the task force help? The second question, as the gradual easing of the lockdown begins on Monday, residents want to know if the task force is thinking of advising the president to reconsider the 7.5 VAT rate to cushion the effect of COVID-19 on private sector businesses. 7.5 VAT. And then the last one. Somebody wants to know how much has been received by the presidential task force from foreign donors. Who keeps the disbursement record? What has been spent and on what? That's it, sir. Thank you, sir.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My question is for the chairman and the Minister of Health, but it's more or less is not here. So the Minister of State, sir. So today is Workers' Day. So the News Agency of Nigeria actually went round to hear from the frontline workers, and we realized that what my colleagues were saying about money collected before being treated, like for PPE, is true. And when we spoke to some of the frontline workers, nurses and doctors, some of them are led to be paid 5% of their salary, that there's a shortfall and they don't have PPEs to work, and they are not being included in the hazard salary, and many more. So I would like to know how the chairman will be addressing this, most especially in the FCT. But our colleague in Lagos found out that people just collect money for PPE before treating Nigerians. My second question is for the NCDC DG. We've expanded in our testing capacity, and the cross still remains sample collection, preparation, and referrals. I would like to know what NCDC will be doing in terms of demand creation. More so, sir, to the Minister of Information, please. Sir, I don't know how we tend to further streamline informations that Nigerians get on COVID-19. I'm saying this relating to what the picture we are all seeing from Cross River State, where a commissioner boldly said that Nigerians have been induced to lie that they are COVID positive and giving millions of naira. So I think this is a big confusion as it is now to some Nigerians not believing that there's a thing like this infection. I don't know what we'll further do to address this, sir. Thank you very much.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Oram from AIT. Mr. Chairman, this question is for you. Now, according to the National Human Rights Commission, they said they have received about 104 complaints of human rights abuse. This is from across the 24 states of the Federation. And about 90% of these human rights violations are from the Nigerian police force, followed by the Nigerian army and from correctional center workers. So it brings me to violations of the journalists who are also on the front line in the fight against COVID-19. There was a case here in the FCT somewhere in Apo where a journalist was beaten up. He was on his way somewhere and he saw a joint task force that were enforcing lockdown. This guy was filming these people molesting a tricycle rider around the Apo axis. And some of these people came to the journalist and asked him what exactly he was doing. He identified himself with his ID card, but that was not enough. They handcuffed this guy with another person, first of all, breaching one of the rules of the NCDC of social distancing. This guy was eventually taken to a magistrate court around, and he was given 3 hours of community service and also a fine of 5,000 naira. So it brings me to my question. As a journalist, your ID card, is it not enough for you to carry out your legitimate duties? And apart from that, I also want you to plead with the IGP of police to train some of their police officers, especially those of the lower rank. They seem not to understand what the role of the media is at the moment, even before the lockdown and after the lockdown. And secondly, I think the DG will want to attempt this one. For we as a family in dark communication and AIT, we have been facing a lot of stigmatization since the confirmation of Raymond Dokpesi Jr. His status to COVID-19. I've seen a lot of people, even in assignment venues, they kind of segregate. So I really don't know what you have to say about that. Maybe you kind of enlighten Nigerians. The difference between social distancing and stigmatization. So I want you to elaborate on that. And finally, sir, there seems to be a consensus among some governors to slash the salaries of workers. And looking at the fact that some of them are in the front line of this COVID-19, and some states are also owing salaries. So I want you to react to this also. Thank you.
The chairman, members of the task force, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually is for the Minister of Health. But unfortunately, he stepped out. But I'll just, send this to the Minister of State for Health. Well, yesterday, the Minister of Health told us that he had received an interim report as it concerns the occurrence in Kano State. So I'm sure 24 hours is enough time for you to at least have a bit of information concerning that report that you've seen and studied it. So I want to know really what is happening in Kano, and this death that has been recorded, is it somehow related to COVID-19? Nigerians are really anxious and they want answers, really, because every day we see the numbers keep going up in Kano, so we want to be able to marry the facts together. And my next question is for the Minister of Information and Culture. Well, Rachel had spoken about, what we need to do to enlighten people more that COVID-19 is real. My concern really is about the armed forces, those at the front line of the battle against Boko Haram. What are we doing to inform them about COVID-19. I ask this because recently we've seen a lot of movement, especially in the north, where we're seeing Almajiris being moved together, and some of them have even tested positive in the states that, they've got into. So what are we doing to inform them of the fight other than Boko Haram that Nigeria and the whole world is really dealing with at the moment? And finally, my last question is for the DG of the NCDC. Well, sir, yesterday you told us that nationwide we have about 3,500 bed capacity in our isolation centers all across the country. And you were appealing, really to everyone to help in the fight against this virus and, donate even their space. But we want to know, this 3,500 that we have, what states are lagging behind in terms of upscaling the bed space? Because we're seeing these numbers, almost every state in the country now has recorded one case or another. So what states in particular do we need help in terms of upscaling our bed capacity in isolation centers? So that way, private business owners, even hotels, can come in and help out. Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is for the SGF. So many NGOs are springing up with the sole aim of fighting COVID-19. There is one in particular, Stamp Out COVID, which suggests that checkpoints should also serve as testing points for the coronavirus. Is government considering working with them along that line? Secondly, I want to draw you back a bit. Yesterday, I asked a question, and it says a good number of senior civil servants working in Abuja live in either Suleja or Kefi. With the ban on interstate travels, what is their fate? Many of them do not have vehicles of their own, and others do not work with organizations that have staff buses to convey them to and fro. Thank you.
The chairman and members of the Presidential Task Force and Nigerians at home. My name is Mitaire Ikwen of NTA. I want to ask the chairman of the Presidential Task Force. Testing 2 million people in 3 months will definitely lead to increase of confirmed cases. And if we begin to have more confirmed cases and the situation gets out of hand, are we going to revert to a lockdown? Then as a follow-up to one of the questions asked by my colleague on Kanu for the DG NCDC, you said verbal autopsies are ongoing. What are your findings from these verbal autopsies about the situation of mysterious deaths in Kanu? And finally, concerning the curfew from 8 p.m. to 6 a.m. We know that a lot of, in Lagos and Abuja, for example, a lot of Nigerians live in the suburbs. They live outside the city center. Most of them wake up 4 a.m. to try to beat the traffic and come to town. But with the curfew time from 8 p.m. to 6 a.m., are the security agencies prepared for the kind of gridlock that could arise from everybody hitting the road by 6 a.m.? Those are my questions. Thank you.
Good evening, SGF, ministers, and my colleagues. My question goes to the minister, Second Minister, Education. Ajụjụ ga-awụ n'Igbo. Ihe nnachi jụụ na aka na-achị steeti Anambra kọwara na n'ụbọchị Mọnde n'ụlọ akwụkwọ praịmarị na nke sekọndịrị ga-amalite ịgụ akwụkwọ. Ajụjụ m na-ajụ wee bụrụ, kedu ihe ga-abụ okwukwe maọbụ echiche ebe ndị ọzọ, steeti ndị ọzọ nke a na-agwabe ka ha malite ịgụ akwụkwọ? Iche ha na ọ ga-abụ ihe mwute nye ha na ndị ọzọ ga-aka wee mụta ihe karịa ha nwa ndị nọ n'ụlọ na-enweghị ụlọ akwụkwọ ha na-aga. Thank you.
Speak English, please, so that I can understand.
Okay, my question is, Anambra State Governor has said that by Monday, primary schools and secondary schools should resume and workers should start going to work. What will be the fate of those who the states have not declared that the schools and the workers should start going to work? Won't it leave a psychological effect on them? Thank you.
Good evening. My name is Friday Okeribe. I'm a reporter with Channels TV. I'd like to direct my first set of questions to the WHO country rep. My first question has to do with the numbers of vaccines and treatments that have been undergoing clinical trials. What information do you have? Do you have any vaccine or any treatment in the offing as we speak? The second question also to the country rep, I would like you to take us through what is the process of certifying a drug or a vaccine and approving it by WHO for treatment. I'm asking this question because in the past, we've seen a lot of efforts by Africans. In the days of Ebola in this country, the then Minister of Health confirmed that some treatments that we use were actually produced in Nigeria. Even though they were very effective in curing Ebola, up to now, none of them have been certified by WHO. So what is the process? The second question, I would like to direct it to either the Minister of Health or the DG NCDC. How many contacts are we actually tracing as we speak today? Because some time ago you told us the number of contacts we were tracing in Lagos and Abuja when the peak was in Lagos and Abuja. Now we have Kano. How many contacts are you tracing? I also like you to respond to this actually from a viewer who said that I should help him ask. Is it possible, or are you considering setting up some sample collection centers in the markets now that we'll be resuming some of the markets as from Monday, especially in cities like Lagos, FCT, and Kano? Are you considering opening some sample collection centers in some of these markets? Thank you.
Thank you very much. That wraps up the questions coming in. We have the questions directed at the Honorable Minister of Health. The Minister of State will take his questions. The Director General NCDC, followed by the WHO representative. After that group, the Honorable Minister of Information and Culture will take the podium before the Secretary to Government and Chairman PTF wraps it up. We'll begin with the Honorable Minister of State for Health.
Thank you very much, Mr. Chairman and my colleagues on the team, the PTF team and respected House, the journalists here present. Let me join my colleagues in saying congratulations to the Labour, NLC in particular, and then of course the entire workforce, as today marks the Workers' Day. I want to salute all workers in this country and in particular and the entire world in general for their sacrifice and labor of love. The questions for me, I think the first one came from Rachel, that's a Voice of Nigeria. News agency, I'm sorry, okay. Sorry for that mix-up. News Agency of Nigeria, NAN, yeah. And it has to do with allegation, I would say, that in some hospitals, patients are being asked to bring PPEs before treatment. If that happens at all, that is a strange demand. And without mincing words, I will say that's illegal, it's unacceptable, and of course condemnable. I do not expect any treatment center or hospital or any clinic to be making such demands from patients. But be that as it may, we will definitely seek additional information in this regard with a view to enabling us do appropriate investigation and, of course, take appropriate remedial actions in this regard. I think it's bad enough for a patient to come to the hospital and you compound the problem by making demands that are not within the ambit of what is expected. So we will look into that, and we hope that your good selves will also assist us in terms of giving us information, because we need information to work on. That is not to say that we will not put in place our own machinery as well, in order to know who exactly these culprits are. Having said that, we will also want to know whether this is taking place in tertiary hospitals or the federal government-owned institutions or the state. And if it's irrespective of where this is happening, whether at the state institutions or at the federal level, we will definitely want to seek intervention and do what is appropriate in the circumstance. I think the next question is from, Amaka Arise. I hope I got that right this time around. Essentially, you will want to know what the situation is in Kano, having said at this forum, I think a day or two ago, that we have a team in Kano. Yes, that's exactly what I'm going to address. Yes, we did have an interim report in place after the team has been dispatched to Kano. And what that interim report contains essentially, and that has been made available to the PTF, essentially is to let us know the level of engagement, because that's the first thing to do. Engagement with the state government in terms of the governor himself, and of course the state team that is in charge of COVID-19 response in the state. That's the first level of engagement. Then engagement with the various segments of the Kano state. You're talking of the faith-based organizations, the civil society groups, community leaders, and every other group that is in Kano, because when we talk about the approach to managing COVID-19, we talk of all of society and all of government approach. So you need everybody to come on board. So this engagement took place already, and that gave opportunity to have information that will be required in order to unravel the totality of what happened in Kano, even beyond COVID-19, where that is the case. So that's the first thing that has been done. And I can also tell you that in addition to this, as at this point in time, we have assembled appropriate resources. That is, human health resources. We have assembled those that will also help to build capacity in Kano. And of course, you recall that at the point in time, the lab in Kano was shut down. But this lab has been reopened now because the proper things that were to be done had been done in terms of biosafety, biosecurity, and of course in terms of having the right personnel to handle the lab. So it's functioning now. You recall that for a few days you were not having a report in terms of the lab in Kano. And part of the things done already is the verbal autopsy that one of your colleagues mentioned. And of course, there is need for strengthening the entire structures on ground, whether in terms of surveillance, in terms of contact tracing, in terms of the facilities, be it isolation centers and, of course, treatment centers in the entire place. Of course, the PPEs have been deployed and ambulances as well to Kano as we speak, and other consumables are needed. So these are some of the things that have been put in place, and the PTF is going to set up a kind of independent secretariat in Kano, but I will work with the state government in order to unravel whatever that needs to be unraveled in terms of particularly the number of deaths that had gone up astronomically. And of course, we also have the necessary support in terms of personnel to make all this possible. So it's ongoing in terms of, we're not stopping, and of course I can also tell you that the PTF as a body will have visited Kano by yesterday, but for the demise of the father of the coordinator, the national coordinator of PTF. So that is the situation for now in Kano in terms of what the Dara report says. Of course, maybe just to add that you have immediate measures, as have been mentioned. You also have medium and long-term measures to be put in place. I think the final question is from Friday Channels. I hope I got that right as well. Friday, well, essentially, I think it's about the number of contacts being traced. I know the NCDC will give you that details. But let me just say that it's difficult, even at this point in time, to start reeling out figures in terms of contacts at this point in time. Because when you have a situation that you are dealing with community transmission, it's extremely difficult to have contacts tracing that is accurate. But be that as it may, I think the DG of NCDC will give you the full details if that is available. Thank you.
Sorry, you did not say anything about the salaries we have to
About? Salary. Oh, okay. Yes, that is not true. Everyone that is in the system, there are three categories. The category of doctors, dentists, the category of pharmacists, medical laboratory scientists, and others in that group. And the third category, they are cleaners, ward mates, attendants, and of course, some others who are not necessarily health workers, but they are working in the environment that is potentially hazardous. So they have all been captured. So everybody is captured, and you will recall that I think sometimes last week or early this week, I did explain that it's been taken through the whole gamut of federal civil service structure. So these are things that are on ground already. But when you talk of the hazard allowance, it's not just the health workers alone, but people who are working in a potentially hazardous environment have been captured. I did mention all that. So they are captured. And this is within that civil service structure. And I did say then that the Minister of Labor and Employment was part of the whole deal, and all the workers through their various representatives, be it pharmacists, be it doctors, be it medical lab scientists, and all the unions, 37 unions represented by Johesu, they were all captured. So no one is really left out. And not just in terms of incentives given to them, but in terms of insurance. And the volunteers who are not captured within the framework of federal civil service, they are captured by donated insurance packages from those who have been helping us as donors. Thank you.
So thank you very much. Just a few questions. There was a question on sample collection and on the demand side. Right now, yesterday we tested 2,000 samples. So that's the highest number of samples we've tested in a single day across the country. And these numbers have been increasing every day. So despite the challenges in parts of the country, the truth is samples are coming into our laboratory network across the entire network. So there's a lot of effort being made by healthcare workers, despite some challenges here and there. In terms of, I think there was a good question on stigmatization and the balance between social distancing and stigmatization. We've said this severally in this press conference. It's really unfortunate. Imagine if that's happening in Abuja, what would be happening across the country for homes or communities where individuals have been affected or infected. So we really encourage all Nigerians. You know, we're in the beginning of a journey. And the most likely scenario is that until we have a vaccine, we will have to learn to live with COVID-19 in our country. So if we start stigmatizing each other, I don't know where it'll stop, because the same people that are stigmatizing one group will end up being infected themselves tomorrow. So really, we have to tell ourselves the truth about this and encourage each other that this is really, there's no point, because all of us here are just as vulnerable to catching the infection as many other people. We do our best, but we always have to remember it's a virus. You can't build a wall, so anything can still happen despite our best efforts. In terms of bed spaces, we have about, from the information we receive from the states, because every day we ask the states, how many beds do you have ready? So from the information they feed back to us, we have about 3,500 beds available right now. And every state we push them to make more beds available. We have a breakdown of those, but I don't have it here to share. So that's really where we are. So we encourage every private sector partner, if you want to support a state, please do so in the state where you're living. Where you're working or where you think you want to support. So there's no state in Nigeria, even Lagos, even FCT, that has fully fulfilled the bed capacity that they need to respond to this outbreak. No single state in Nigeria has achieved that. The investigations in Kano are ongoing. They're led by the Kano state government. So whenever they're ready, we'll release them. But these things are not easy. I've made an analogy previously to a crime scene investigation. It takes a while, so we will share those results as soon as we have them. But the key thing is, are these results supporting the response in Kano State right now? And yes, they are. In terms of the number of contacts, like the Honorable Minister of State for Health said, it's a very fluid number because every day there are new cases, and with every new case there are new contacts. But we're following up cumulatively about 12,000 contacts across the country from the beginning of the outbreak. and the final question on, are you considering sample collection in the markets? Like we said, we are driven by the evidence. So if we see that there's increasing transmission in a market setting, we will go to that market. But we're not going to set up stands in every market across Nigeria to collect samples. So we look at the data, we use the data every day to make decisions. And if we have to go into markets or a specific market, we'll do exactly that. So thank you very much. Have a happy Workers' Day finally.
The Chair of the Presidential Task Force, honorable members of the task force, ladies and gentlemen, I also would like to salute all workers on this important day, World Labor Day, and in particular, health workers who are working tirelessly around the clock to keep us all safe. Your efforts are well appreciated. On the subject of vaccines and clinical trials for COVID, I'd like to say that research and development is an important aspect of the response, and researchers around the world are working hard on accelerating the development of vaccines and therapeutics for COVID-19. WHO has launched various working groups to accelerate various aspects of vaccine development. A call was made by 130 scientists, funders, and manufacturers to help speed the availability of a vaccine for COVID-19. And together with global health actors and partners, over the past week, WHO launched the Access to COVID-19 Tools, ACT, Accelerator, a global collaboration to accelerate development, production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. We have a total of 89 vaccines that are in development globally, including 7 in clinical evaluation, and several therapeutics are in clinical trials. WHO is committed to ensuring that as medicines and vaccines are developed, they are shared equitably with all countries and people. We do have the Solidarity Trial that some of you may have heard about. It's an international clinical trial to help find an effective treatment for COVID-19, launched by the WHO and partners. More than 100 countries have joined the Solidarity Trial, and to date, over 1,200 patients have been randomized from the first 5 countries to evaluate the safety and efficacy of 4 drugs and drug combinations. Nigeria has also expressed interest to be part of this Solidarity Trial, and efforts are underway to start the process in Nigeria. The process itself for certification of vaccines is a very rigorous and thorough process, because we aim to ensure that products that are approved for use meet safety requirements. Once a product is submitted to WHO for review, there is a detailed process for pre-qualification that includes review of all the data on the clinical trials that are expected, and that this data should meet the global safety standards. We work with national regulatory authorities on assessments, licensure, and post-marketing surveillance. All this is important before a vaccine is actually approved. So just to conclude, to date, we do not yet have a vaccine. The trials are underway in a very accelerated process. It usually takes years to produce a vaccine, but the emergency process currently ongoing is really aiming to get a vaccine out as soon as possible for protection of people. Thank you.
Thank you. we'll take the Honorable Minister of Information and Culture.
Mr. Chairman and members of the PTF COVID-19, gentlemen of the press, permit me to join all those who have spoken before me to felicitate with the Nigerian Labour Congress on the May Day celebrations, and also the opportunity to express our appreciation to the organized labor for the support the government and the committee in particular has received from them in the fight against COVID-19. There are two questions which were addressed to me, three actually. The first actually is why people are not taking the COVID-19 pandemic as seriously as they ought to. But the truth of the matter is that COVID-19 is real. And the issue is about life and death. And we at the PTF will continue to take this matter very seriously. I don't believe that any reasonable person actually would trivialize the issue of COVID-19. And if they do, that will be a very serious mistake on their part. And we will continue on our own part as PTF to address these issues. We've been doing a lot at the level of the PTF to keep Nigerians informed through the various jingles, television commercials, the social media, etc., about the pandemic. Even this daily national briefing is part of our efforts to keep Nigerians informed. We'll continue to improve on this in the days ahead. We're rolling out new jingles and TVCs on such issues as stigmatization and the need to have personal protective measures, such as, wearing of face masks. But I want to remind you that the NOI poll showed that 99% Nigerians are aware of COVID-19. So the problem is not that of awareness, but perhaps that of mischief on the part of some people, which is quite regrettable. The PTF is not relying just on jingles, sensitizations, and TBCs, but it's also embarking on community relationship, because we believe that if the community does not take possession or ownership of COVID-19, our efforts might not be as successful. And the PTF devoted quite a substantial part of its meeting today on how to get the community involved. And working with our partners, the NCDC and the Ministry of Health, we have resolved to revive the over 3,000 operatives in Kano State alone, who were used when the fight against polio and to a lesser extent Lassa fever became problematic. These are the foot soldiers who work within the community, who the community trusts, and who was also asked as scouts for the PTF and the NCDC to identify houses where we need to address the issue of testing. They also work very effectively to help us to trace contacts. These are part of the decisions that were arrived at this morning at the PTF meeting. On the issue of the military, I'm happy to say that the military is not only fully aware of COVID-19, they are doing a lot to support the fight against the pandemic. I'm sure on several occasions there, the ministers of health, the DG, NCDC, the chairman, we have all expressed individually the role that the military have been playing in the fight against COVID-19. But for them, we would not have been able to achieve what we've achieved so far, either in terms of delivering logistics or, getting our staff around. But in addition, the military, they've also made, life-saving equipment, and they've also provided, transportation logistics for the PTF. There's no doubt that they are also keeping their personnel at the war front against Boko Haram fully informed. The military is, as you know, is one of the most dynamic national institutions that we have. And the safety and security of the military personnel who are daily making great sacrifices to keep all of us safe is always a priority. As you know, we also, at the PTF, we meet regularly with the entire, security, heads. And as a matter of fact, we'll be meeting again tomorrow. And we have been assured that these meetings of the Air Force have been taken, not just by the military, but the police and other security agencies to ensure that the pandemic is contained. The third question, which I'm sure the SGF will also, explain further on, is the issue of the media and the harassment of the media. I think we've made it clear that the valid identity card of any media organization is enough proof that the holder has a right to move freely. If there are cases of, excesses from the security agencies, well, I can assure you this matter will be taken up at the highest level. Like I said, we'll be meeting with the security forces tomorrow again, and we are going to escalate this matter. Thank you very much.
Thank you. We shall now take the SGF and chairman of the Presidential Task Force.
The first question was, I think, regarding contractors not being paid. That was directed at me. Well, I know that at the beginning of the year, in the first quarter, the Ministry of Finance released about 280 billion naira to the different ministries and agencies as part of the releases for the first quarter from the 2020 budget. I believe some contractors have been paid. Not all. And as we progress in the application of the budget, though now really disrupted, people will continue to receive their monies for legitimate businesses that they have executed on behalf of the government. That is as much as I can say about that. The issue of VAT, whether government should consider suspending VAT. If you recall in my statement, when I spoke about the need to ease up the lockdown so that businesses can come on stream, part of what I spoke about was to allow trade, taxation, and the other things. Because government must derive revenue to be able to meet even overheads of its management and personnel costs. We have been dependent on oil, and we can see the disruption that has happened with regards to our earnings in the oil and gas sector. The benchmark we had for the budget has totally been distorted. Now what we have is determined by market forces. How we sell, what quantity we sell is totally beyond us. So there is a major decline in government revenue. VAT is a component of government revenue. Taxes, either income tax or company tax, are all parts of government revenue. The increase from 5% to 7.5% was just brought into application in February of 2020, all in an attempt to ramp up resources to meet our 2020 budget and into the future. Let me explain even the sharing formula for VAT. Of whatever is earned through the value added tax, only 15% goes to the federal government. 85% is shared between the states and the local governments. So if you reduce VAT and couple with a decrease of income that comes into the consolidated revenue fund of the Federation, where states at the end of the month gather to share through the Federation account allocation meeting, there will be crisis. I can tell you there will be crisis. So whatever we need to do in terms of rigorous and elaborate and extensive collection of revenue, we must do that to be able to compensate for the losses that are coming in as a result of the downturn in our earnings with regards to the oil and gas. So, and mostly, VAT is always on luxury items. Most of the essential items are VAT exempted, like drugs, sanitary things. Basic consumables are exempted from VAT. VAT is always related to luxurious consumptions. So I think as much as possible, I'm not sure I would want to advise at this stage for us to consider a reduction in the 7.5% VAT, because that will really eat into the earnings of the states and the local governments. Somebody alluded to the fact that salaries are not even being paid. So a major reduction with regards to our sources of earning will further deepen that crisis. So I think we must find a balance now to try as much as possible to maintain some bit of economic and physical stability in the system so that we do not jeopardize the interests and the earnings of our people. Somebody asked about how much has been collected and expended by the Presidential Task Force. Let me make this very, very clear. That the Presidential Task Force is not a revenue or a donation collection agency. The Accountant General has opened 2 accounts in the central bank and 5 in the commercial banks. The purposes of our national response to the COVID-19 pandemic. Private donors, like different organizations, charitable organizations, individuals, have been advised to pay these monies directly into those 5 accounts in the different commercial banks. And it is the responsibility of the Accountant General on a daily basis to mop those amounts of money and transfer them to the central bank accounts for the purposes of administration. The Presidential Task Force is built up in such a way that it is multi-sectoral. That's why you see this number of ministers with different responsibilities. We have a budget that we have submitted. When the monies are made available, and some part of it have been made available to the different ministries for the purposes of execution of the part of the mandate of the Presidential Task Force that falls under their responsibilities. At the appropriate moment, we will render accounts. So the Presidential Task Force is not a contract awarding institution. The instruments of every ministry will be used for the purposes of the procurement. Ours is coordination and general supervision. So when you hear that the COVID have raised 21 billion, please, the 21 billion does not come to the Presidential Task Force. Or you hear NMPC and its partners have raised 21 billion. The 21 billion does not come to the Presidential Task Force. Or you hear the European Union making a contribution of 50 million euros. It does not come in cash to the Presidential Task Force. All these contributions are specific project identified commitments. Some have taken upon themselves to build isolation centers. Some are procuring vehicles. Some are procuring the ventilators and different consumables, PPEs, masks, and different other items. But I can assure you, we are responsible people, and we will be responsible with whatever is committed into our hands. At the appropriate moment, we will render accounts from time to time as to how we are faring. But for now, I'm not sure anybody has awarded any contract. Nobody has received any money, except probably for agencies of governments that have been involved even before the setting up of the Presidential Task Force. You will realize that this response started even before the Presidential Task Force came on board. There was a question about 104 human rights abuses, and mostly with the police, army, and the National Correctional Forces. This was asked by AIT. We have established a protocol with the Human Rights Commission. We've advised them that if there are cases of infraction of human rights, draw their attention and file the report to the appropriate agency for necessary action before you can confirm either the authenticity of the complaint that has been laid, or you confirm the veracity of the story. And we've done that. And you can see by certain actions that have been taken, particularly by the Nigerian police, in terms of discipline, where an officer or an inspector with another one were dismissed from the force as a result of the establishment of an abuse on a woman somewhere, I think it's either Ondo or Ogun, and similarly in other places. Actions are being taken. But the reports must first be filed so that the agency would have the responsibility through their own processes that have been established by law to either court-martial them or to do a guardroom trial or whatever it is. But there are processes, and I can assure you that Mr. President is very concerned about any element of human rights abuse, and as long as we remain as a task force, we would ensure these issues are investigated and dealt with appropriately. The fifth question here is about state salaries being slashed. Well, to a large extent, I would disqualify myself from making any comments on that. I'm incompetent. I don't run a subnational government. I don't know what must have informed those decisions. I can speak authoritatively for the federal government. Nobody's salary has been slashed. Out of our own volition, the members of the Federal Executive Council donated 50% of their salary willingly. So that is as much as that is concerned. I think those questions can be better directed at the state governors who have taken those decisions. But I think those decisions might have been taken in conjunction with the people of the state. These are very, very difficult times that require very drastic solutions. So that could have been what informed those decisions in the state. Civil servants working or living in Suleja and working in Abuja. We acknowledge that as a challenge. If you see the protocol that we released, we were even mindful about intrastate movement. We mentioned there that we discourage movement across local governments, but we acknowledge the fact that in metropolitan areas like Lagos and Abuja, if you restrict movement across local governments, it will hinder a lot of work. Because like in Lagos, virtually all the local governments are consigned within one city. If you say you are going to restrict those kind of intrastate movements, it will damage what you want to achieve. So I believe Abuja particularly and Lagos will be looking at the issues of border or interstate movement. Because I acknowledge the fact that substantially most of the people that work in the civil service and even in the private organizations in Abuja, a lot of them live in Suleja. Some live in Karu, on the part of Nasarawa State, not the Karu of Abuja. So that would be a major challenge, but we will draw the attention of these entities, FCT and Lagos, to look at how they can work out that. The president was very, very clear in his mind when he advised that these are the guidelines, but states can modify them to suit their peculiarities, but to remain within the framework of the desired objective that we want to achieve. The other question is what happens if there is a spike in the numbers? Well, that's a very difficult question. Experiences from other nations that have eased up the lockdown, there have been spikes. Even our sister country very close by, Ghana, 10 days after the lockdown, the figures just went up. Germany had that experience. Several other countries have experienced that. And everybody is navigating the rough road, trying to find a solution to it. Part of what I see them do is that they try as much as possible, in spite of the spike, to ensure very strict compliance. Because sometimes, if we can be disciplined enough, compliance does not become a major problem. Sweden, there's no lockdown, there's no use of mask, but compliance has been part of their culture. But we have a challenge with that. If we can just get our people to understand that this is a collective responsibility, that we must work together to ensure that these directives and guidelines are meant for our good, I think we will be able to cross that particular Rubicon. Anambra, I understand what happened in Anambra is that the governor said teachers will return on Monday, but students will remain at home and continue with e-learning. That is the position of Anambra to the best of my knowledge. I stand to be contradicted, I stand to be corrected on that. He did not say that schools will resume. No, teachers will report as other civil servants are reporting, but students will remain at home and apply themselves through the e-learning process. And I believe if we do that, in most places, we will be able to get a better understanding of the situation and move forward. As I conclude, just a quick reminder of where we are. On the 30th of January, when the WHO declared COVID-19 as a major health challenge of international concern, we had 7,818 infections globally. 7,818 infections globally, out of which 7,736 were in China. Only 82 were outside China. By today is 3 months. Only 82 were out of China. And these 82 were in 18 countries. As of yesterday, 30th of April, 2020, 3 months after, the record globally is about 3.3 million infections, with 213 countries and territories with infections. I'm painting this picture so that we appreciate the magnitude of the problem we are dealing with. Within a period of 3 months, with just 82 infections, we are now at 3.3 million and in 213 countries of the world recording infections. Going forward, as a country and as a people, we must challenge ourselves that we will do everything humanly possible to ensure that we apply ourselves, in spite of the inconveniences, to do what is needful to reduce the level of our infection, flatten the curve, and begin to see a decrease on the expansion. As of today, we have only just 2 states, I think, Tukwe, that have not reported. Just 2 states that have not reported. So it means that if we are not helped in the next, I'm not praying, but if they spread and the picture I see internationally is what would apply here in Nigeria, then we must be prepared. I will remind us again and again that the time for personal responsibility is now. And we better own up to this, that we have a part to play as individuals and collectively as a people to ensure that we do everything to flatten the curve and begin to see a decrease in the levels of infection. Thank you. I wish you. What is that? Well, I think that's an advice that I will leave for the Ministry of Health and the Nigerian Center for Disease Control, being experts, to look at the prospects and the possibilities of conducting checks at checkpoints, so that in the process of wanting to do that, you do not build the kind of traffic that will completely defeat the essence of social distancing and all other adversaries that we have sent out there. So it must be a balance. It must be a balance. It must be a balance. Thank you.
Thank you very much, SGF. That brings us to the end of today's national briefing. We must thank our partners, as always. We must thank the organized labor for teaming up with us. We must thank the media partners that have been broadcasting into the homes of Nigerians. Of course, our partners, the NAPTIP and site savers, the environmental health officers, and all of those that have contributed in one way or the other to this, bringing these events to you. We say thank you. But a number of messages have come out, judging from some of the questions and the responses. One is that COVID-19 is real. It is indeed not a joke. 3.3 million cases in 3 months shows that it is not a joke and that it is a matter of life and death. Please take responsibility, play your part, and keep the numbers low. Well, in the mood of celebration with our workers, we say thank you. We thank our healthcare workers, the media, security agents, and indeed all workers from different sectors that go out into the storm of COVID-19 every day. They take the risks. We say thank you to you. You are the pride of our nation. Don't give up. Finally, we as a nation must rally together to show how strong we are. Together, we shall overcome. I thank you very much for being with us. God bless Nigeria. We'll see you on Monday.
That was the daily briefing by the Presidential Task Force on COVID-19. Thanks for rejoining us on Nationwide. And Nationwide continues with an update on the deployment of more grains to Kano by the National Emergency Management Agency, NEMA. Let's now join our correspondent, Ilyasu Ali Yakubu in Kano.
Trailer loads of the federal government grains continues to arrive Kano State in meeting up with the deadline of delivering 110 trucks this week, as promised by the Director General, National Emergency Management Agency, Mustafa Mehajab. Although the total number of trucks expected to be delivered in Kano are more than 300. Out of the 110 trucks expected to be delivered this week, 52 are already on ground and are being offloaded. The breakdown of the total delivery shows that 100 trailer loads of millet, 110 trucks of maize and sorghum are expected to be delivered in Kano. I spoke earlier with the Executive Secretary, Kano State Emergency Management Agency, Dr. Saleh Aliyu, on the mechanism put in place to ensure immediate distribution of the items to the actual beneficiaries. And these were his words.
So in order to not make it as a political committee, so a district head at the local government is the head of that committee, followed by imam or pastor who will assist him. And then at the ward level, a ward head is also being the chairman, followed by the imam or pastor at that level to deputize for him. Other security agencies, both at the local government, at the state level, at the ward level, were members. At the same time, you find that all the community-based organizations in that locality are members. This is built to ensure that the right people are being selected to get this gesture by the Kano State government and now by the federal government.
From Kano, Ilyasu Ali Yakubu, NTA News.
Thank you very much, Ilyasu. We now join Mitari Ikwen to let us in on some salient issues on today's briefing by the Presidential Task Force on COVID-19. Mitari, it's over to you.
Okay, thank you, Ifoma. Today, the Presidential Task Force felicitated with Nigerian workers on the occasion of the May Day celebration. And it says it appreciates the sacrifices, especially of essential workers who are in the front line in the fight and the battle against the coronavirus. And also the Presidential Task Force says that it is committed to providing personal protective equipment for all essential workers in a bid to ensure that they are well protected as they are in the front line in the fight against coronavirus. Also today, the chairman of the Presidential Task Force, Boss Mustafa, challenged Nigerian scientists and researchers to join the myriads of projects going on to develop vaccine for the coronavirus. And the WHO representative in the Presidential Task Force told us today that 89 vaccine development projects are going on around the world and being supervised by the WHO to come up with a vaccine for the coronavirus. So those are some of the highlights that came up at the briefing today.
Thank you very much, Mitare, for the highlights. And let's move to Owerri now, where the collapsed 80-story building under construction has left residents of the Imo State capital in shock, as most of the workers are believed to be trapped under the rubble. Kubuike Chukwu, who visited the scene of the incident, reports that rescue efforts are still ongoing.
The 8-story building, which was under construction, is located on Umaru Musa Yar'Adua Drive, Owerri, the Imo State capital. Information from eyewitnesses shows that the unfortunate incident occurred about 4 o'clock in the evening, Thursday, April 30th. While construction workers whose actual number could not be readily ascertained due to conflicting figures given by different individuals were still busy in the building. Some of them who were still in shock after the incident declined comments on camera. Few of them told NTA News that many people were working in the building when the incident occurred.
The ground started shaking. We thought if it was this container tanker that do pass along, that is to jump gallop. So unknowingly to us, we look at this hotel. It didn't start from back there and start falling down. So the process of falling down, we started shouting. Then the front of this hotel just fall down. Immediately we ran into the hotel and started saving people. In fact, as I told you, even there are some boys under this hotel now that this thing fall on top, and there are some that we brought out alive up there. They took those on to the hospital.
Members of the medical team who declined press interview confirmed that many workers are believed to be trapped in the collapsed building. 11 persons have been rescued, while 1 death has so far been recorded. As at the time of filing this report, rescue effort by the Nigerian Red Cross Society and the Imo State government was ongoing. No concrete reason has, however, been given as the cause of the building collapse. In Owerri, Chukwubuike Chukwu, NTA News.
Meanwhile, Chairman Council of Registered Engineers in Nigeria, Imo State, Venetius Igiri, says the owners of the collapsed building did not get authorization for such construction, stressing that necessary steps will be taken to ascertain the cause of the collapse.
A number of days can cause that.
We sincerely apologize for the poor audio in that report. And Lagos is where we go now, and Dotun is ready to guide us with reports from there. Hello, Dotun.
Thank you, Ifoma. The Ministry of Humanitarian Affairs, Disaster Management and Social Development has taken delivery of tons of food items from the Nigeria Customs Service for onward transmission to low-income earners who may be going through a hard time during the COVID-19 lockdown. Abolore Ogbara reports that the consignment is part of goods seized by the Customs Service.
The federal government has expressed its readiness to expand the social register for distribution of food and other important items during the lockdown order. Against this backdrop, the Comptroller Nigerian Customs Service, Western Marine Command, Peter Olugboyega presented 720 bags of rice, 297 bales of used clothing, and 11 sacks of used shoes to the Ministry of Humanitarian Affairs, Disaster Management and Social Development.
I do hereby hand over these items to the representative of the Minister of Humanitarian Affairs, Disaster Management and Social Development.
The Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadiya Farouk, who was represented, said the items will be distributed across some states of the Federation in furtherance of government's determination to make Nigerians comfortable at a desperate time like this.
All states are taking 3 trucks of rice, that is 1,800 bags or 50 kg rice, to ensure that we bring succor to them at this point in time of COVID-19 worldwide saga.
This is the third batch of items from the Customs Service to the ministry. In Lagos, Abolore Wara, NTA News.
Posters who paraded themselves as army personnel in Lagos have been apprehended and presented for prosecution by the 81 Division of the Nigerian Army. Olumide Ogutola reports that 31 suspects have so far been arrested for the crime.
At different areas in Lagos during the Operation Checkmate conducted by 81 Division Nigerian Army Cantonment, these suspects were nabbed for offences ranging from unauthorized use of army camouflage to escort contraband rice, molestation and harassment of civilians, extortions and unlawful possession of genuine Nigerian Army identity cards. These 2 namesakes, for instance, are dismissed officers and as civilians are to face the wrath of the law for making portraits of themselves with army uniforms.
Somebody somewhere just suggests there is this picture that looks like you. Let me bring it for you. That was how I saw the edited picture. But stupidly, I collected it and hung it in the house for the fact that the Omonile will not come near me.
I bought it from Abuja Abacha Barak. So after I used to use it to escort motor to this Tokumbo at times.
The General Officer Commanding 81 Division Nigerian Army, Major General Olubumi Irifin, told journalists that the Operation Checkmate is yielding the desired results.
All these arrests you are seeing based on information and the Operation Checkmate that is currently ongoing. And we will continue to do this operation until we clean Lagos and its environment of this kind of hooligans.
Major General Irifin advised Nigerians to always notify the army of useful information that will assist them in apprehending criminals in the society. In Lagos, Olumide Ogutola, NTA News.
And that's it from here. It's back to Ifeoma in Abuja for the continuation of Nationwide.
Bottom, we now take some messages. Nationwide continues shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
The board, management and staff of the Nigeria Social Insurance Trust Fund, NSITF, felicitate with all Nigerian workers on the 2020 Workers' Day celebrations. We particularly acknowledge the dedication of the frontline workers who are the heroes and heroines in the war against the dreaded COVID-19 pandemic. As we join millions of other Nigerians in solidarity with you, we reaffirm our commitment to the promotion of a safe work environment for all patriots working to build our great nation. We will surely overcome. Stay safe, stay alive. Happy Workers' Day. NSITF, a commitment to employees' welfare. Management. Announcer.
Shegun. Alpha, say tomorrow still day on.
What's your tomorrow?
Community meeting now.
You know they hear Abi?
Na beggy. See, if we meet for my house, inside parlor, then go no.
This COVID-19 is not a child's play.
If you want to elect a new secretary, we fit to
Do one for WhatsApp, or for Skype, or even on Zoom. Or we just wait.
I will not negotiate.
This social distancing, it is not negotiable.
Not every infected person shows symptoms, but every infected person is contagious. Avoid large gatherings and self-isolate if you think you might have come in contact with a carrier. Your safety and the safety of others is in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Wetin be this coronavirus thing? Na true?
You see this coronavirus wey be COVID-19. Na the whole world palava and e don dey kill many people for China, Italy, UK, US, Spain, and even for other countries dem.
Okay, wetin come be the reason wey dem say make everybody tanda for house?
Na because if e dey waka pium go carry am from person wey don get am, you go carry come give your family dem. Na so the thing take dey kill other people for other countries.
Okay, wetin come be that social distancing sef?
You see social distance. Now make we no come close because this thing now from air and touch now we dey contact am. We suppose dey at least 6 foot away from each other every time.
So okay, no be only to wash your hand and to sanitize them alone.
Make we no take this washing of hand thing take play but make we come together, join hand as we take pursue Ebola, pursue this coronavirus. Make we be each other keepers now.
Thanks for staying with us. Ibadan is our next port of call, and Kemi, is your turn on Nationwide.
Thank you, Ifoma, and welcome to Ibadan. Oyo State government has hinted on its desire to make commercial agriculture the backbone of a state's economy. Governor Seyi Makinde made this known during a visit to some of the farms within the state. Dayo Ogunshola has details.
Exploring the full potential of agriculture to boost the state's economy is among the 4 cardinal points of Governor Seyi Makinde's administration. Therefore, to walk the talk, Governor Makinde was at Akufo Farm Settlement for on-the-spot assessment of the facility. Delighted by what he met on ground, Governor Makinde said the facility will be upgraded to a farm estate aimed at exploring the comparative advantage of Oyo State in the agricultural sector.
Came to find out firsthand, what is really happening and how can we best support them so that they can, in turn, contribute meaningfully to the economy of Oyo State.
Presently, the farm settlement is being used by a private farm specializing in the production of tomato and pepper through greenhouse farming approach. In Ibadan, Dayo Ogunshola, NTA News.
Non-essential interstate travelers will have to stop until further notice, as Osun State Monitoring Team has stepped up to its operation to ensure strict compliance with the interstate movement ban, which is geared towards containing the spread of COVID-19 in the country. Correspondent Tope Alabi has details.
Osun State is surrounded by 5 states: Ogun, Ondo, Ekiti, Kwara, and Oyo states. Over the borders, Ashejire remains a strategic gateway to many parts of the country, and this informed the volume of human and vehicular traffic. Aware of the challenge of community transmission of COVID-19, Governor Gboyega Oyetola had appealed to security agencies to step up enforcement of the ban on interstate travels.
When lorries they claim to be bringing in foodstuff,
we realize that most times, particularly at night, they transport passengers.
With the restrictions on interstate movements as agreed by the Governors Forum and directed by the President in his national broadcast, some commuters not on essential services have continued to flagrantly defy the order. In view of this recalcitrant nature of some transporters, security agencies have refused to allow unauthorized entry to Osun State, especially from the Ashijire axis.
My daughter is sick and she's in hospital in Ife. That's why I was traveling.
I have to go and search for my means of livelihood.
Except for vehicles or travelers on essential duties and those with permit, others were being turned back from the Ashijire point here, where the Osun State border is located. From Ashijire, Tope Alabi, NTA News.
And that's it from Ibadan. Nationwide continues after this time out. Stay with us.
يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون.
The glorious month of Ramadan is here again, and we at Al-Habibiyah Islamic Society once again call on all faithful to observe the physical and social distancing directive of the government to curb the spread of COVID-19. Always wash your hands with soap and water, use hand sanitizers and face masks when necessary, and stay at home. Observe your obligatory salat, tarawih, tahajjud, du'as, and askars with your families from the comfort of your home. Stay at home, stay safe, stop the spread of COVID-19. This message is from Al-Habibiyah Islamic Society, from Allah to you, a light.
Hello everyone, hope you are keeping safe by washing your hands with soap or using sanitizer. Stay at home, it's the responsible thing to do, and whilst you're at it, you can do anything to keep your body and your mind together. Grow a beard like me if you want to, but please, let's stay at home. It's the responsible thing to do.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
The Nigerian Supreme Council for Islamic Affairs, under the leadership of its President General, His Eminence, the Sultan of Sokoto, Alhaji Muhammad Saad Abubakar, CFR MNI, congratulates the Muslim Ummah on the commencement of the fasting of the month of Ramadan, beseeching Allah to grant us the blessings of the month and to inscribe us among the inhabitants of Al-Jannah. The Council has directed the suspension of congregational Taraweeh prayers, Majalis al-Tafsir, Quranic sessions, and i'tikaf seclusion in the mosques during the month of Ramadan. Islamic scholars and organizations are to employ the electronic media for dissemination of tafsir and other da'wah activities. Janazah, washing, shrouding, prayer and burial of Muslim victims are to be carried out by officials of the Nigeria Center for Disease Control, NCDC, and other government health officials. Detailed guidelines on the suspension and the janazah are available on the Council's website and are being published in national dailies and sent to the federal and state governments as well as leadership of state councils and various Islamic organizations. The Quran says, "Make not your own hands contribute to your destruction." His Eminence the Sultan praised the Almighty Allah to preserve our lives beyond the Ramadan and grant us its blessings. Mr. Yusuf Nwoha, Director Administration, Nigerian Supreme Council for Islamic Affairs, announcer.
You're welcome back. Suleiman in Kaduna is standing by for more contributions on Nationwide.
And welcome to Kaduna. Like every other socio-economic and political concerns of the populace, the fate of the annual commemoration of this year's May Day has equally been altered by the coronavirus pandemic that has redefined the rule of engagement in all facets of life. Majama Adamu in this report takes a look at Workers' Day amidst the imperative of social distancing.
It is a May Day unlike any other such day in the last 4 decades. It is a May Day whose characteristic euphoria and assertive anthem of solidarity have been silenced by a global pandemic that has put to test the might of the worker as an agent of human survival and progress.
This is the first time that we couldn't have rallies, we couldn't have marches, we couldn't have open manifestations to celebrate the May Day.
Beyond the specter of deserted streets and work institutions under lock and key lies the thriving spirit of the workers. Many of them at the forefront of the battle against the pandemic. Workers, unrelenting and undoubted, as they give their whole as a sacrifice to fatherland.
This has posed a serious challenge on the part of the workers, taking into cognizance of the fact that we lack the basic necessary protections for the workers. And I want to salute Nigerian workers today for coming out from their heart. They couldn't be outside, but to show that labor is an important factor of national development.
As the Nigerian workers collaborate with the government and other patriotic stakeholders to salvage the country from the socio-economic ruins propelled by this pandemic, their hope is to put behind this tall tale of tragedy so that when next they commemorate May Day, they would have recouped their silent voice and together sing the anthem of solidarity forever. In Kaduna, Majama Adamu, NTA News.
There are indications that exchange of currency from one hand to another could transmit COVID-19. It is on the heels of this that Abdullah Muhammad examines daily transaction of an array of individuals using cash and the risk involved.
The proponent of a cashless society may have some things in common with Nicodemus, the man who is said to have seen tomorrow. Not only that their initiative has saved the global community billions in the cost of printing and management of currencies, but also defended billions of people across the world from the risk associated with infected notes.
A look at this 500 Naira bill shows a lot of security inscriptions and features. Its serial number, the date that this currency was printed. But what is missing on this 500 Naira bill is the list of people that must have come in contact with it, especially those that must have contracted the deadly coronavirus.
All the noise about the Naira bill being one of the means of spreading COVID-19 could pass for speculation if it is not coming from a reliable source. And as part of my mandate to get to the root of these speculations and unveil the reality, I asked one of those in the forefront of the fight against the dreaded coronavirus to put the record straight.
The World Health Organization recently passed a statement as regards to that, in that they implied that in some certain cases, COVID-19 can be transmitted through banknotes. But so far, there has not been a verifiable research to confirm that viruses can be transmitted through the banknotes.
Though many Nigerians have come to terms with how to stay safe from the ravaging effect of COVID-19, majority of those involved in the exchange of currencies have continued to do so without any form of protection.
We have nothing to do about it, but sometimes they say if you put the money in the sun, that the virus will die.
Money is very necessary at this point in time.
Reports suggest that China and Korea had, in their fight against COVID-19, disinfected and isolated dirty bank notes using ultraviolet light to sterilize the notes. If this is one of the measures that helped the Chinese and Koreans, then it is a venture that is worth the while. In Kaduna, Abdullahi Mohammed, NTA News.
And with that report, Ifoma will continue with Nationwide in Abuja.
Thank you very much, Suleiman. Women as caregivers are now benefiting from the consignment of palliatives received by the Minister of Women Affairs from the wife of the President, Aisha Muhammadu Buhari. Different women groups from across Abuja received items worth millions of naira for onward distribution to the needy. Momso Damien Date reports.
These are leaders of women groups trooping to this collection center. The women have found their voices again to sing the International Women's Song after being muted for many weeks by COVID-19. This time, however, they are not demanding for equal rights, but to show gratitude and appreciation for bags of variety of food items, hand sanitizers, face masks, hand gloves, and other medical items donated by Mrs. Aisha Buhari and are here being distributed by the Women Minister.
The wife of the president is simply showing us her concern as a mother. You as leaders, most of you can afford to feed yourselves. Most of you can even extend and help your neighbors. I beg you in the name of God, ensure that all that has been given to you as leaders reaches those in need in your organization.
For the women representatives, there is no better time than now.
The unexpected have been sending messages of desperation, fear. On behalf of the masses, on behalf of the grassroots, we are saying thank you very much.
That inshallah, all what she has given to us, to the less privileged, we get to them.
Always been praying so that this COVID will be out of our country, Nigeria.
Each group knows their women and they know those that will be in their need of this.
And it shows the trust building between Nigerian women and government.
Having taken delivery here, louder songs are expected when they hand over the items to the most vulnerable in their communities and groups. In Abuja, Momso Damien Ati, NTA News.
In the meantime, residents around the nation's capital, Abuja, especially the less privileged, have continued to enjoy support in form of palliative to cushion the effect of the lockdown. Senior Special Assistant to the President, President Muhammadu Buhari on Student Affairs, Nasir Saidu, led a group of Nigerian youth task force on COVID-19 to distribute relief materials. The distribution of food items and other relief materials was held at Dakwa and Pape satellite communities in the Federal Capital Territory.
And we are very happy for this kind gesture showed by good Nigerians. This is the things we have been calling, let be our brothers keepers at all levels, because government cannot do it alone. We have to show our concern to our brothers and our relatives.
And we're trying to do that to support the federal government initiative in seeing how to cushion and bring ease to many Nigerians that are suffering from this lockdown. Why we are here, and there are so many places that we are going. It's not only palliative we are distributing. It's a group of young doctors. We have doctors that are going around the houses one by one and see if there's any patient that they will give him support or her support, and see how we can ease the health system in Nigeria.
The group appealed to Nigerians to support the measures put in place by the Presidential Task Force and the FCT Experts Committee as a way of curbing the spread of the coronavirus. And Ekiti State has joined the League of Beneficiaries of Motorized Fumigators, courtesy of the Oni of Ife, Oba Enitong Adeyeye Ogunwusi. Kola Adebobuyi quotes Governor Kayode Fayemi as saying the gesture of the monarch will assist in checking the spread of COVID-19 in the state.
The Fumigators, an initiative of House of Oduduwa Machine Tools, was designed by the Oni of Ife in promoting homegrown efforts at combating coronavirus in the country. Oba Adeyeye Ogunwusi noted that the fight against coronavirus must not be left for government alone, but require collective efforts of every concerned citizen. Hence the step to complement other veritable efforts to stop the ravaging COVID-19 with the provision of the motorized modular fumigators.
We cannot just fold our hands. We have to propose solutions. We have to look at ways and manners things can be better for all our subjects. We don't need to lead our leaders. We don't need to lead them.
Governor Kadifayemi commended the Oni of Ife for the giant stride towards saving the country, especially the state, in combating the spread of coronavirus.
We are grateful to you for always, at all times, having us in mind. Anything that has to do with progress, that has to do with development, that has to do with our community, you are as you.
The fumigators stakeholders believe we go a long way in disinfecting streets of the state from the coronavirus disease. In Ado-Ekiti, Kola Adibobwi, NTA News.
Purposeful surveillance at the boundaries of Rivers State in Opobo Kingdom has become imperative to enhance the efficiency of the interstate lockdown. Chairman Rivers State Traditional Rulers Council, King Dadinson Jaja Jeki V, said this in an exclusive chat with correspondent Amezi Igebo.
The high-level sensitization in the serene town of Opobo on COVID-19, a disease with no known cure, is palpable. Some billboards at strategic locations within the kingdom signposted the reality of the infamous pandemic.
We have been trying, following government directives, to sensitize our people by sending out town criers to go around and tell the people that they require the observance of certain rules of hygiene. Recently, government sent 5 truckloads of food to Opobo Koron local government, and it's been quite sufficient. People are very grateful.
King Dadinson Jaja Jeki V is, however, concerned about the porous nature of some boundary communities.
For instance, the whole of Anthony Opobo axis, we don't seem to have any of such things. People come in from Akwa Ibom through Otaiwa here, they can come into Opobo and from there to Port Harcourt.
The royal father, who recently turned 87, is religiously taking the lead in adopting the precautionary measures to stay safe.
Ameze Igebo, NTA News.
The judiciary is also feeling the negative effects of the lockdown occasioned by the coronavirus pandemic, with many court cases earlier slated for hearing being adjourned while the courts observe the lockdown. Olabode Arewa in this report examines the prospect of using technology to conduct virtual court proceedings in Nigeria.
In the wake of the outbreak of COVID-19, courts in the country shut down due to reasons of social distancing, with a few courts conducting proceedings on the cases that are time-bound. A senior advocate of Nigeria, Professor Akishaya George, believes the time has come for judicial proceedings to be conducted using the virtual format. He said the National Judicial Council had led the way with its recent national meeting, which was conducted without face-to-face contact.
Virtual court is the way to go. As we start to implement it, you will see that we'll perfect it, we'll fine-tune it. And then it's going to save us a lot of money. Building of courtrooms, traveling. Sometimes lawyers travel all the way from Lagos. They come to Abuja, the case is not going on. But now, if everything is done electronically, we'll be more conscious of time.
Another senior advocate of Nigeria, Joe Kiari Gazama, observed that if adopted in full, conducting of proceedings using technology was in everyone's best interest.
We must be up and doing in terms of virtual sitting. We said the time with that number in the past that courts should fix cases according to time. You fix my case maybe 9 o'clock, another case maybe 11, another 12, another 1. That is what is being done everywhere if it is physical hearing. Now with this challenge of COVID-19, I think we must go back to the drawing board and see how we can rapidly catch up with what is the practice, what is the tradition, what is the norm in other established jurisdictions.
When the courts resume sitting after the coronavirus pandemic ends, they will have a plethora of outstanding cases to attend to. In Abuja, Olabode Arewa, NTA News.
The Armed Forces of Nigeria says it has neutralized some Boko Haram terrorists and destroyed some of their logistics facilities at Parisu in the Sambisa Forest area of Borno State. A statement by the Coordinator, Directorate of Defense Media Operations, Major General John Enenche, indicates that this was achieved in airstrikes conducted by the Air Task Force of Operation Lafia Dole on 30th April 2020 after surveillance missions confirmed significant terrorist activities in the area whilst identifying some compounds housing the fighters and their logistics. The Air Task Force then dispatched NAV fighter jets to attack the location, scoring accurate bomb and rocket strikes, resulting in the destruction of some of the structures as well as the killing of several terrorists, as seen in a now declassified video clip. The Armed Forces of Nigeria says it will continue to sustain the offensive against the enemies of our country until peace and normalcy are restored in all parts of Nigeria. And with that, we conclude Nationwide for today. We thank you for watching. Remember to always stay safe.
NTA, you can't beat the rich.
Fellow Nigerians, follow the instructions on social distancing. The irresponsibility of the few can lead to the death of many. Your freedom ends where other people's rights begin. The security agencies have risen to the challenges posed by this unprecedented situation with gallantry, and I commend them. I urge them to continue to maintain utmost vigilance, firmness, as well as restraint in enforcing the restriction orders while not neglecting statutory security responsibilities.
Akili, 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 akili. Will you wash your hands with me? I want to wash my hands with you. Come on, I will show you what to do. Wash your hands in clean water. Wash your hands, wet them with the water. Wash your hands, now add some soap. Scrub your hands in the soap and water. Scrub above and below between the fingers too. Scrub under your nails and scrub-a-dub-a-doo. Rinse your hands in water. Rinse them clean, rinse away the soap. Dry your hands and go.
Akili, why do we wash our hands?
To wash away the germs.
Akili, what are germs?
They're like tiny little bugs on your hands, and they can make you sick.
But I don't see any germs on my hand.
That's because they're so tiny that you can't even see them.
Oh, wow. I want to wash the germs away. Will you wash your hands with me, Akili?
Of course! Wash your hands in clean water. Wash your hands, wet them with the water. Wash your hands, now add some soap. Scrub your hands in the soap and water. Scrub above and below between the fingers too. Scrub under your nails and scrub-a-dub-a-doo. Rinse your hands in water. Rinse them clean, rinse away the soap. Dry your hands and go. Great job, Haruma! Can you tell me the 4 things we did to wash our hands?
can try.
1.
Wash our hands with water.
2.
Put soap on our hands.
3.
Scrub, scrub, scrub our hands all over.
4.
Rinse our hands clean with water.
This is the network service of the NTA.
The art and craft of filmmaking transcends just being an actor, a producer, or even a director. There are so many angles to what we know as the motion picture industry, and these are the angles that we seek to bring to you, our esteemed viewers, week in, week out, on that program, Nigerian Movies Today. I am Ololade Adeniji Adele. On the show today, we're going to be taking you away from what we regularly know as filmmaking. We shall bring you some interesting angles to the motion picture industry. But first, let's start with our curtain raiser, which is our movie of the week. Our movie of the week is a feature film which mirrors the reality of Lagos with the intent to show how people go the extreme to keep up appearances. A 2019 drama film, The Bling Lagosian is a movie which reveals the ostentatious lifestyle of Lagos high society, the fake underbelly of Lagos, a lot of people who pretend to be what they are not. Written by Anthony Kende Joseph and directed by Bolanle Austin Peters in what serves as her directorial debut, this movie parades a cast of Elvina Ibru, Jide Kosoko, Mona Lisa Chinda, Benga Titiloye, Toyin Abraham, Alex Akubo, Osasi Godaro Ajibade, Bisola Ayola, and a host of others.
I beg your pardon.
You people did not miss me.
I bought Googie. Googie? Yes, I bought Burberry. There's this one that
just did mad shopping.
Did you follow me?
The Bling Lagosian tells us the story of the Holloways, a powerful and most prestigious family presently living in the past glory, which consists of Akin, Mukpelola, Demidun, and Tokumbo. The matriarch, Mukpelola, never disappoints when it comes to flaunting the family's extreme wealth. She is resolute on throwing a flamboyant and the biggest society 51st birthday party, one which will top the headline-making shindig she threw the year before for her 50th. Things, however, take a turn for worse when she unwittingly sets a series of events in motion which threaten to expose the family's huge debt as the Asset Management Corporation closes in to foreclose on St. Ives Towers, the family business, especially after the death of Baba Eko, the godfather who had been protecting Akin Holloway, the suave husband of Mukbelola. How will the family cover it all up when she is 100% reluctant to cut back on her extravagant lifestyle? This is one question the Bling Lagosians attempt to answer. If you had taken a close look at our movie of the week, you would have seen that there were different elements that came to play, and chief of which was sound. That is the focus of our discussion today with our exclusive guest. Let's find out who this individual is who does so much with sound in filmmaking. Our exclusive guest is a medical doctor, film score composer, music producer, and talented musician. Born 26 December in the cosmopolitan city of Lagos, Bayo Adepetun, fondly called Dr. B, attended Our Lady of Apostles Private School, Yaba. Secondary education was in the ancient city of Ibadan, where he attended the government college and earned his secondary school leaving certificate. He also attended the international school also in Ibadan for his A-levels. Tertiary education was at the College of Medicine, University of Lagos, Akoka, in 1976, where he bagged a degree in medicine in the year 1981. Further studies took him to the University College, London, precisely the London School of Hygiene and Tropical Medicine. There, he bagged a Masters of Science in Clinical Tropical Medicine. The first child in a family of 4 children, Bayo Adikpetun, who hails from Ondo West local government area of Ondo State, southwest Nigeria, began his medical practice in the year 1982. With a strong passion for music from his days in the university, the medical doctor, who had always done music and sound design, commenced media production in the year 1988, thereby running one of the very earliest and most efficient digital media production outfits in Nigeria at the time. Through his self-financed studio, Dr. B commenced the production of radio jingles, from which he expanded to music for television and film, as well as sound design. An accomplished music composer and soundtrack producer, Bayo Adikpetun has over 7,000 radio jingles in different Nigerian languages to his credit. Some of these include the popular 80s and 90s Union Bank jingle, Big, Strong, Reliable, Do Good, Castle and Castle, to mention but a few. He has also composed, scored and produced music for film and television series, among which are Wedding Party 2, New Money, King of Boys, Chief Daddy, and many more. On our exclusive guest segment today, I have someone with me who is a doctor of all. Because interestingly, he operates from 2 different ends. But well, our focus is basically on the motion picture industry. Please join me as I make welcome Dr. Bayo Adikpetun, fondly called Dr. B. Hello, Dr. B.
Hello.
How are you? Good to have you here with us on the show.
Very well, thank you. I'm happy.
Okay, there's something I didn't tell our viewers. I just, introduced you as Dr. B. But really, Dr. B is a medical doctor. Yes, a medical doctor. But for so many of our films in Nigeria and a lot of the popular adverts, radio jingles and adverts, this is the man that has been scoring the music. And when we say scoring, basically producing the soundtrack, for a lot of these films. Once again, you're welcome. Dr. B, you're a medical doctor, and that has actually just been ringing in my head. What is a medical doctor